Okay. Today we are going to discuss acts related to public health. We should be careful about this lecture because this topic is not given in our textbook of preventive and social medicine. But I am purposefully taking this topic because considering the pandemic of COVID-19, sometimes the SAQ may be asked about the Epidemic Act or whatever. So this is a lecture regarding acts related to public health. Public health means it is the science and art of preventing disease, prolonging life, promoting health through organized community effort. Legislation means law and regulation. It can serve as a potent tool to improve the health. But this legislation should not be buried in the statute books. It has to be used and enforced effectively. To have healthy society, citizens must know the laws and they must demand their rights related to the health. So the acts related to public health can be grouped as related to prevention of disease, that is Epidemic Act, then Prevention of Food Adulteration Act, etc. The acts may be related to the healthcare delivery, that is Drugs and Cosmetic Act, ESI Act, Medical Negligence Act, etc. Then acts may be related to the environment, that is prevention and control of pollution, the acts related to prevention and control of pollution. There are some population acts like registration of births and deaths. We have discussed this in the sources of health information system. So we have to register the births and deaths, then only we can get the information. So there is a act of registration of births and deaths. Then MTP Act is there, PCPNDT Act is there, which is related to population. The next group is acts related to occupational health, that it includes CSI Act, Factories Act, Maternity Benefit Acts, etc. And there are some other laws related to health issues like Consumer Protection Act. So first we'll discuss acts related to prevention of infection and epidemic control. This is very important act considering today's situation. So the first act related to this, that is Epidemic Diseases Act, was launched in 1897, that is before the independence of the India. So British government launched this act, Epidemic Diseases Act. We all know the definition of epidemic, that is occurrence of disease or health problem in a community or specific region in excess of normal expectancy. And now for COVID-19, we are using the word pandemic, means the epidemic which have crossed the international boundaries. So this Epidemic Disease Act provides power to implement remedies for control and prevention of spread of epidemic in the states of country. The states can authorize any officer or agency to take such measures. Usually district magistrate or collector of the district are authorized to inspect and determine the process of control of epidemic. So for considering today's COVID pandemic, each district collector has the authority to inspect the process of controlling the epidemic in that particular district, and accordingly he can implement the measures for prevention and control. So he can seal that area, he can lock down, or he can declare that area as a hotspot. So all these authorities are decentralized to collector for that particular district. State has responsibility to provide expenses incurred for traveling, segregation, temporary accommodation of infected persons. So whatever expenses which are required for traveling, for segregation of people, or for providing temporary accommodation for infected persons, these expenses should be borne by the state government. Vehicles needed for transport of persons and equipments are also provided by the state government. This act was amended in 1994. There was an epidemic of plague in Maharashtra, and in 1994, this act was launched, that is Maharashtra Prevention of Infection and Spread of Epidemic Disease Act. It deals with notification of infected towns or villages, banning entry to the infected areas, segregation, isolation of persons coming from the infected areas, and disinfection of public vehicles arriving and departing from infected persons. So now this inter-district travel is banned. Even the people are not allowed to enter crossing the borders of the districts. So all these come under the Epidemic Disease Act. The next act is Prevention of Food Adulteration Act. So again, I will tell you that Epidemic Act, you have to learn properly and remember properly because this may be asked as a SAQ. Now, next act is Prevention of Food Adulteration Act. It is also frequently asked SAQ in MUHS exams. This act was enacted by Indian Parliament in 1954. Objectives are to ensure the pure and wholesome food which should be provided to all the consumers and protect them from the deceptive trade practices. Act was amended in 1964, 1976 and recently in 1986 to make the act more stringent. A minimum imprisonment of 6 months with a minimum fine of 1,000 rupees is envisaged under the act for cases which are proved to be adulterated. The cases of adulteration which may render the food injurious to cause death or grievous hurt. So if that adulterated food has caused the serious damage or death, then punishment may be increased up to lifetime imprisonment and a fine which should be more than 5,000. There is a Central Committee for Food Standards which frames the rules and standards for which are also called as PFAM standard, that is Prevention of Food Adulteration Standards. So any food that does not conform to the minimum standards is said to be adulterated. Although it is a central act, the implementation of this PFA Act is carried out by the state government and by the local bodies in the respective areas. Food inspectors are there, and these food inspectors, their job is to visit the various sectors where this food is sold, prepared, and they can collect the food samples and send them for the analysis to the central laboratory. A chain of food laboratories in the districts of state and 4 regional central food laboratories are there. The 4 regional central food laboratories are situated in Kolkata, Mysore, Ghaziabad and Pune. Also at district level, the district food, public health laboratory is there. You have visited that public health laboratory. So there the analysis of food is done. So food adulteration is a social evil. The general public, traders, food inspectors, all are responsible for perpetuating this evil. Why the public? Because lack of awareness about the dangers of adulteration and their general disinterest. Even if they found the food adulterated, they will not go and complain again that. So a lot of lack of awareness, like ignorance is there. So they are also at fault. Traders are also at fault for their greed of money, and food inspectors are also at fault. They find food adulteration as a fertile ground to make easy money and corruption. So all are at fault. The next act is legislations related to Drugs and Cosmetic Act. This act is to regulate import, manufacture, distribution and sale of drugs and cosmetics. No person can import or manufacture or sell any medicine which is not of standard quality or which is misbranded, adulterated, etc. A license is required for import or manufacture or sale of a drug. So central and state government shall appoint inspectors and analysts for implementation of this Drugs and Cosmetics Act. There is another act called as Narcotic Drugs Act, which deals with prevention and illicit traffic and abuse of narcotic drugs like opium, cannabis, etc. Cigarette and Tobacco Products Act 2003, it was asked as a SAQ few years back. So this is important act, you have to remember this. This act implements measures to protect non-smokers from involuntary exposure to the tobacco smoke. There is a risk of passive smoking. So the smokers, because of these smokers, they also impose the risk to the non-smokers. And in order to protect them, this act is there. So smoking in public places like hospitals, public transport vehicles, educational institutes is banned and it has a fine up to 200 rupees. There is also punishment for advertisement of tobacco products. There is imprisonment for 2 to 5 years and fine up to 1,000 to 5,000 rupees. No person shall sell cigarettes or tobacco products to children below 18 years. Or there should not be such shop which sells the cigarettes or tobacco products within 100 yards of any educational institute. But I think this law is not followed. There are many shops near our educational institute which are selling these cigarettes or tobacco products. Every package of tobacco products should have prominent warning and label regarding health hazards and the contents of tar and nicotine should be displayed. So any person, manufacturer or distributor who contravenes this act can have fine and imprisonment. Even if you see on the television, even in that movie, if there is a scene showing this consumption of tobacco or alcohol, a small note comes that धूम्रपान और मद्यपान सेहत के लिए हानिकारक है. So this is as per the Tobacco Products Act 2003. The next act is law of tort. Tort means to twist. Tortuous conduct means a conduct which is twisted or unlawful. Medical negligence is an important area in law of torts and Consumer Protection Act also. But as per the recent amendment, now this our doctors are exempted from this Consumer Protection Act also. So when a doctor is consulted by a patient, any breach of his duties, like duty of care, there are certain duties of a doctor, like duty of care, whether deciding to undertake the case, whether to treat the case or not, that is one duty. Then to decide and administer the correct treatment is another duty. And if any breach in this duty, it is considered as a medical negligence and it is a punishable offense. So doctors who provide free services and government hospitals are now exempted from CPA, but private practitioners are liable for any negligence under CPA. But as I think as per the current amendments in CPA, so all doctors, including private practitioners, are exempted from CPA. Then legislation in healthcare delivery field is an important means to ensure the quality of the healthcare services. The next important act which can be asked in exams is PCPNDT Act. The long form is Preconception and Prenatal Diagnostic Techniques Act. Prevention of Preconception and Prenatal Diagnostic Techniques Act, prohibition. So this act was enacted for prohibition of sex selection before or after conception, and also for regulation of prenatal diagnostic techniques. As per this act, no person, no organization or clinic shall be used for or any prenatal diagnostic technique like sonography should not be used for sex determination. Under this act, any doctor, owner of the clinic can be punished for prenatal sex determination, and the punishment is imprisonment for 3 to 5 years and the fine which may be for 10,000 to 50,000. So as per this act, it imposes restrictions on clinics, doctors and sale of USG machines. So only registered genetic clinics can use for prenatal diagnostic techniques. These prenatal diagnostic techniques should not be conducted anywhere. So it should be conducted only in the registered genetic clinics. It should be done by a qualified medical practitioner. Sex selection is strictly prohibited. Even the sale of ultrasound machine to unregistered laboratories or unregistered clinics and persons is prohibited as per this act. A license is required for purchasing this USG machine. So prenatal diagnostic techniques can be used only for detection. So they should not be used haphazardly. They should be used only under following conditions. So if you suspect any chromosomal abnormalities or if genetic metabolic diseases is suspected, if diagnosis for diagnosis of hemoglobinopathies or diagnosis of sex-linked genetic disorders, in that situation only the sex determination is allowed. There are certain disorders related to X chromosomes like hemophilia. So these sex-linked genetic diseases, in that situation only the prenatal diagnostic technique can be used for diagnosis of sex, unless it should not be used. It can be used for congenital detection of congenital anomalies or for any other abnormalities. So the Preconception and Prenatal Diagnostic Techniques Act 1994, it gives certain essential communications. It means we should explain all the known side effects, after effects and test procedures to the couple before undergoing this prenatal diagnostic technique. Written consent must be taken in prescribed form and its copy should be given to the pregnant lady. We should not disclose the sex of fetus even by signs or words also. Otherwise, there is a tendency to disclose the sex by certain signs like Monday. Come for follow-up on Monday, if the sex is male. or come for follow-up on Friday, means the sex is female. So even certain sign language should not be used to disclose the sex. Then there should be prominent display in local language that disclosure of sex of fetus is prohibited under law. So if you visit in our radiology department or any radiologist, you will see the display, prominent display, and it is written in local language that disclosure of sex is of the fetus is prohibited under law. Registration certificate to be displayed prominently in the clinic. The registration certificate of the machine of the doctor, it should be prominently displayed in the clinic. Not only doctor, but any person, including pregnant woman, her relative, who seeks the aid of technology for sex determination. Sometimes the couple may have desire and they may ask you to determine, tell the sex of the baby. But under this law, even they are also punishable. However, declining sex ratio in India, it indicates that this PCPNDT Act is not enforced properly. So sometimes the twisted question may be asked like this. In one MUHS exam, the long LAQ was asked, what are the causes of declining sex ratio and which laws are lacking. So in that certain twisted question, you have to write about PCPNDT Act as well as MTP Act, because these are the consequences of improper implementation of PCPNDT and MTP Act. Declining sex ratio indicates that this PCPNDT Act and MTP Act, they are not properly implemented. So such twisted question may be asked. So MTP Act 1971, it lays down the conditions under which a pregnancy can be terminated, a person or persons who can perform such termination, and the place where such terminations can be performed. So these all three are defined under the MTP Act. We have discussed this MTP Act in detail in our MCH lecture, but again we'll just quickly revise. So conditions identified under MTP Act. So MTP can be done if there is any medical condition like continuation of pregnancy may cause grave injury to the physical, mental health of the woman. In that situation, MTP is permitted. It can be permitted on eugenic grounds if the baby has some physical or mental abnormality suspected. In that situation, MTP can be done. Humanitarian ground if the pregnancy is as a result of rape or sexual assault. In that situation, MTP can be done. Socio-economic ground or failure of contraceptive devices. This condition is unique feature of Indian law, and actually it's a loophole. Many times MTPs are done by giving this reason, that is failure of contraceptive. A written consent from the couple, or if you are doing MTP for a minor that is below 18 years, then you have to take the written consent from the guardian. The person, second is the person or persons who can perform abortion. So registered medical practitioner having experience in OBGYN to perform abortion where the duration of pregnancy is less than 12 weeks. And if the duration of pregnancy is more than 12 weeks, then the opinion of two RMPs, two registered medical practitioners' opinion is necessary to terminate the pregnancy. The third condition under this act is where you can do the abortion. So there are certain authorized clinics, private practitioners clinics or government hospitals where the MTP can be done. MTP rules 1975 approval by the board. Under these new rules, the chief medical officer of the district is empowered to certify that a doctor can do the MTP, or the even the now the certification board procedure was tedious procedure, so it was removed, and now the decentralization is done, and the chief medical officer of the district can give the certificate about the MTP, where the MTP can be done or who can do the MTP. Qualifications required as per the new rule are 6 months house post in OBGYN or postgraduate qualification in OBGYN, 3 years practice in OBGYN for those doctors registered before 1971, or 1 year practice in OBGYN, those who are registered after 1971. So even non-governmental institutions may take up the abortions provided they have obtained a license from Chief Medical Officer of the district. Now acts related to